Dr. Pukose was speaking, Mr. Speaker, I know that this is a bill that is a national kind of bill. It's a national function, strengthening the national blood transfusion services. And Mr. Speaker, he said that every region has a regional blood transfusion center. What is the point of, Mr. Speaker, of talking about national issues when health is a devolved function? Why aren't we talking about strengthening our counties, Mr. Speaker? Why are we budgeting for health in our counties when we cannot afford to strengthen the counties and enable all our referral hospitals, Mr. Speaker, like Migori, level 5 or level whatever, have services, Mr. Speaker, that actually donate blood in the most efficient manner, Mr. Speaker. It is only yesterday, Mr. Speaker, that we actually debated the finance bill. And you saw, Mr. Speaker, that services to do with healthcare in this country, you know, those machines for health, for cancer, for HIV, for what? Those services, Mr. Speaker, as per the finance teams that ensure that healthcare is guaranteed, especially healthcare equipment that do with blood transfusion. So, Mr. Speaker, I know many of us here have received blood in one way or the other, or have actually donated blood in one way or the other. And, Mr. Speaker, you can see the pain in this country when, and especially during this period of Corona, Mr. Speaker, when the country was locked down, when you are told that you need blood in Nairobi and your relatives are in Ushago, are in Mashambani there, Mr. Speaker, and they could not even afford to come to Nairobi to offer blood. So, Mr. Speaker, for me, this is a good bill, and this is a bill, Mr. Speaker, that is going to ensure that our healthcare system is working. Mr. Speaker, a healthy nation is a working nation, or a working nation, Mr. Speaker, is a healthy nation. So for me, Mr. Speaker, the Committee of Health has literally spoken to so many Kenyans who are suffering. Mr. Speaker, Kenyans are suffering in hospitals. When you get admitted in a hospital, Mr. Speaker, by virtue of you being an MP in a VIP lounge, and you see families struggling to mobilize one another, Mr. Speaker, to donate blood in this country, Mr. Speaker, it is pity. It is annoying, and it is not good, Mr. Speaker. And I've seen those situations, Mr. Speaker, so many times when I'm at the hospital. Mr. Speaker, what we need to do now, as Dr. Pukose was saying, is basically to create that awareness. How do we ensure that we create awareness around issues of blood transfusion, blood donation, Mr. Speaker, so that Kenyans really know that it is okay to donate blood. It is okay to give blood, Mr. Speaker. And how then can we also ensure that even as we strengthen this healthcare system, we are ensuring that, the 8 regional blood transfusion centers, Mr. Speaker, are effective, are working 24/7, Mr. Speaker. Because it is one thing to say we have 6 referrals in every province in this country, yet a person in Migori, for example, Mr. Speaker, cannot access the nearest service in Kisumu, Mr. Speaker. So what we want to do is to reduce the time. How then can we reduce the time that our people waste and spend between being sick and going to Kisumu, for example, or going to Mombasa, Mr. Speaker? So, Mr. Speaker, sir, for me, I want to say that this is a good bill. This is a bill that is protecting the interest, and is a bill that is coming at a time, Mr. Speaker, that we are talking COVID. Mr. Speaker, healthcare has been affected by COVID. Mr. Speaker, it is a bill that has just come from when we are reading the budget. It is a bill that has come when we are talking about the finance bill, Mr. Speaker, that has actually tried to zero rate on healthcare equipment and healthcare materials, Mr. Speaker. This is a good bill, Mr. Speaker, and allow me to support this bill. I thank you, Mr. Speaker.
Thank you, Mr. Speaker. Mr. Speaker, I have stayed long because I waited for this bill. It's an important bill. I had a chance to read through the bill, and I really want to commend the Committee of Health for coming up with these Very, very important bill. And it's coming at the backdrop of a bill that was supposed to be brought by the ministry concerned, that's the Ministry of Health. But anyway, the most important thing is the piece of legislation is before this House. Mr. Speaker, a national blood bank is very critical for the health of our country and for our people. And it's important that we create a dedicated body, and it's put in place to deal with issues of standards and safety of blood. A lot of the members, Mr. Speaker, this afternoon were very general, but let me be specific on this bill. So we must deal with the safety in terms of, and the control, in terms of the donor, the blood donor. How do you recruit it? How do you collection of blood, the testing of blood, the processing of blood, the storing of blood, importing and exporting of blood, issuing and distribution of blood and blood products, as well as the disposal of blood waste. This is what this bill should deal with, and I'm sure it's dealing with, and I've read it, and it's important. So all those aspects are important in the establishment of a national blood bank. Mr. Speaker, it is good now we are putting a law to regulate the activities relating to blood donation and quality control. It's not only about donating, it's about the type and the quality of that blood. Indeed, Mr. Speaker, I saw this bill in coming at the right time, because the Health Act that we passed into. The Speaker, you know there is a very, very important thing that we need to deal with here. It is current state, and we are going to bring amendments that even the donor, you don't walk and just give blood. There must be a procedure, regulation, a law that you must seek the consent of the person donating prior to a blood transfusion. There must be a process of counseling. You know, we are talking about people, once they donate, then they're told your blood cannot be used. It requires a counseling session for that person. It requires disclosures before you donate. You must disclose as a patient, as a person, that you have the following ailment. Can I donate? So there must be disclosure on the part of the donor. There must be confidentiality of the results and issues of conditions. It must be in confidence. When you donate, and your results are different, the doctor, the person there must give you that confidence. Mr. Speaker, we are told as a country we have 64,000 pints annually against a demand of 1 million units. This is a very, very serious. It calls for a national health crisis. Imagine your annual need is 1 million pints, and currently you only have 64,000. Mr. Speaker, you know, imagine a national emergency occurs where we will need blood transfusion for many Kenyans, God forbid. But Mr. Speaker, you know, the culture of waiting for donation. I saw the PS Health and the government getting excited about 354,000 vaccines the whole world. It's in media. Where is the responsibility of that government to vaccinate the 45 million Kenyans? A country like China has vaccinated 1 billion. A country like the US has done 70%. So we are waiting for donation. You know, our whole government is in the airport, past midnight, waiting for a donation from Denmark and saying we are waiting for another donation from the US. Where is government responsibility to the health care of its citizens in vaccinating? Speaker, you know, this house must, with their 13 billion, why are we focused about donation? And I hope this government is not going to wait for donations, blood donations, when there's an emergency. We are being told by Satan that there is an illegal export of blood, pints, millions, thousands, to neighboring countries. We should not defame our neighbors. We should say which countries, who public officers are involved. The minister Kagwe cannot just throw words that our blood is going to our neighboring countries. He must say which country, at what time, and he must hold the public officials under his watch. He must hold them to account. Mr. Speaker, sorry. I'm very, very sorry. Mr. Speaker, the committee should look further, in my opinion, into this bill and propose ways of ensuring that there is integrity by public officers who shall sit in the management of the Kenya National Blood Transfusion Service. There must be. We must not allow cartels to siphon blood donated by Kenyans and sell it to other countries, according to the minister. And this bill must find a way of addressing that. What do we deal with? Public officials who have been given the responsibility and the custody to manage our national blood banks if they play foul play. Mr. Speaker, we are setting up this National Blood Transfusion Service in order to create a national blood bank. So we must have what we call, after our passage of this law, the regulation of the blood donation. And of course, Mr. Speaker, you know, I had many members talking about counties. You know, we must be serious. Since devolution, apart from very few counties I can mention, Kakamega maybe, Makueni, very few. The rest of the counties, healthcare has collapsed in these level 5 hospitals. Yeah. You are talking about taking national blood labs. I will give you an example. Kenya Red Cross built a modern blood bank in Garissa. But they won't run it. Today, it is full of cobwebs. The fridges are not working. Healthcare has collapsed, and we must have a discussion. In fact, this country, instead of discussing this animal called BBI, this country should have a 3-month discussion on the success and the failures of devolution. Because we have done 10 years. We are going towards 10 years. Can we discuss? You have seen our doctors. Doctors are recruited based on nepotism and bias. Mr. Speaker, before devolution, there was a doctor called Dr. Musa, a Nubian surgeon, in Garissa PGH. And before him, all the other heads of that hospital were non-locals. With the advent of devolution, the recruitment, you'll find a nurse supervising a medical officer. I mean, this is, so and this National Blood Transfusion Center, this is a function of the national.
And a center. But Mr. Speaker, I speak as a donor. I'm a regular donor myself. I donate blood once in every 3 months. And as much as I congratulate the Health Committee for coming up with this report, we most importantly must congratulate the close to 160,000 pints that are collected every single year by Kenyans, the Kenyans who actually donate that particular blood. As we're speaking right now, the current figures due to COVID, the Vice Chair was indicating was at about 64,000. On an average, the country collects about 160,000 pints, vis-a-vis what is actually equally a patron of an organization formed by very, very young Kenyans called Red Splash, where we've been able to donate blood regularly for such causes. I equally recall that the figures, when you look at them during the holy month of Ramadan, we always have a very, very low amount of people donating, because people prefer not donating blood during Ramadan, but we come up with campaigns, and these campaigns have been able to save lives. I do not know, and this is something that maybe needs to be taught to every single person, regardless of what your religion is, regardless of what your tribe is, your creed, your financial standing in society. The blood that I donate, I do not know who it has been able to save. The blood that someone else has donated could be someone who comes from a very, very vast and different background than myself. But that person could probably save my life tomorrow. And Mr. Speaker, this is a culture that we need. A tribe is more superior to another tribe. We equally need to tell Kenyans out there that your blood will be able to save someone as much as someone else's blood will be able to save your own. And the Red Cross today in Mombasa does about 6,000 pints annually, Mr. Speaker. Red Splash does about 5,000 pints annually. This is about 11,000 pints out of the 160,000 that is collected. And I'm honored, I'm blessed once again to be part and parcel of an organization that looks up at me and I look up at them without regard to the title that I hold when I represent them in the National Assembly. And we look at it in terms of humanity, that close to 10% of the country's blood is actually done by organizations that I'm associated with. So I want to congratulate the team in Mombasa at the Red Cross. I want to congratulate the Red Splash team. And Mr. Speaker, just to give you and to give Kenyans an in-depth of what it is, ingenuity that can be able to be done, the Red Splash introduced an app, a phone app, where you can be able to download it. And I recommend to everyone who's listening right now to download this particular app. And once you download it, you can give your details as a donor, so it gives you reminders. And not only that, it will give you an alert that in the event there's an accident, there's someone at a certain hospital, it will give you an alert that you are closest to a certain person. And we're urging you, please go and donate blood to that particular person. It even gives you an estimate in all the hospitals. On a regular basis, it is updated to advise you where blood levels are in all those different locations. And I intend to take this bill, have a sit-in with the people that I can comfortably say are part of the ones who made me who I am today. And sit down with them. That is the team of the Red Cross and the Red Splash. We'll go through this bill by virtue of having been a donor, and by virtue of having been, let it be a situation where you do not have to come from one of the very, very few centers within the country that have these facilities. So with this, I wish to support, and I wish to support once again by congratulating every single blood donor in this country. You have saved a life.
Honorable Kerry. Thank you very much, Mr. Speaker. And finally, this bill is here on the floor of the House. Some of us can actually shout hallelujah because it has been long coming, Mr. Speaker. After many false starts, after a very long delay, it is now on the floor of this House. And I dare say, Mr. Speaker, that this bill is urgent. If there was ever an urgent piece of legislation, this is a textbook definition of an urgent piece of legislation, Mr. Speaker. Because the issues that are being canvassed in this bill were urgent many years ago. 2 years ago, when we were initiating the process of this bill so that it gets to the floor of the House. Mr. Speaker, the blood transfusion situation in this country is desperate. And that is why some of us are rising to support this bill. This bill will bring some sanity in this entire blood transfusion space within the country by actually regulating the service, because as it is today, Mr. Speaker, any hospital, any individual, any clinic, any dispensary, and even any quack doctor can today collect blood, transfuse blood, transport blood, and even prepare blood products today without a proper legislation, Mr. Speaker. Mr. Speaker, this bill is giving that much needed legislative framework. As we discuss this, Mr. Speaker, the elephant in the room, as was raised by the very esteemed Dr. Eseli, is the issue of whether we should be having a standalone legislation on blood transfusion or whether we should bring it together as part of the organs and tissue legislation. But Mr. Speaker, I'd like to say that even when the public participation was being conducted by the committee, the issues of blood and organs and tissue transfer, Mr. Speaker, were addressed. And that's why the amendments that the ministry brought were dropped, because the Health Act as it exists today does give provision for the CS to already attend to the matters of organs and tissues, Mr. Speaker. Mr. Speaker, there is a crisis in this country. There is a dire shortage of blood in this country. And that has also led to criminal activities, Mr. Speaker. Quacks and traders trading in blood. In this bill, in Section 8 on penalties and offenses, the trading in blood has been outrightly criminalized. It will now be a criminal enterprise for anyone to collect blood, to transfuse it, to prepare any without the necessary clearances, Mr. Speaker. So, Mr. Speaker, the issues that we are dealing with are critical. I have been hearing figures being mentioned here. The Honorable Danita did mention a figure. The Honorable Abdul Somad did mention a figure. I'd like to mention with authority, Mr. Speaker, that last year, the year 2020, we were able to get 93,000 units of blood against a target of over 500,000, meaning that the shortage is real. So if we do not manage how blood transfusion is managed in this country, then it means that we shall be living on a deficiency that could occasion a disaster at a time when blood is needed in bulk in case of an emergency or otherwise, Mr. Speaker. Mr. Speaker, the blood transfusion space today is manned to the tune of 145 individuals, Mr. Speaker, against a need of over 800 people who are needed to be able to conduct proper blood transfusion services. Mr. Speaker, today, if you needed blood, blood can, that there has been lack of visioning, there has been lack of strategic planning, there has been a low morale among the staff, and that is why it is important that we bring this body corporate by the name of the Kenya National Blood Transfusion Services, Mr. Speaker. Mr. Speaker, the shortage in the hospitals is real. Today, there are patients at the Kenyatta National Hospital who will have to wait for over 3 weeks, will have to wait for over a month, and even ultimately, they might be discharged to other health centers so that they can get blood, Mr. Speaker. So, Mr. Speaker, this piece of legislation is critical. It is critical because we shall finally be able to give autonomy to the Kenya National Blood Transfusion Services to enable them to even be able to manage their financial propriety better. They might even be able to now source for help elsewhere as a body corporate, unlike the situation that we are in, where they are dependent on a ministry that has actually, in the real sense of the word, starving them, leading to the situation that I had described earlier. Mr. Speaker, this bill seeks out to spell out a process of recruitment and management, and especially at the top level to strengthen collaboration, Mr. Speaker, at all levels of devolved governance, and that will provide better services in this whole blood transfusion space. Mr. Speaker, because I know the interest is high, I want to summarize before my time is over, but it would be sacrilegious of me to sit without acknowledging so many patriotic Kenyans who have put in a lot of work, burnt the midnight oil to ensure that this bill lands on the floor of this house today. I would like to make a special mention of an individual, a Kenyan patriot, by the name of Joe Agendo, very well known to many members of this house because of the amazing work that he did in the organization called the Blood Link. He has been the man who has been whipping us to push this blood transfusion bill to be a priority so that it can be canvassed in this house, passed, so that we can start reaping the benefits. Mr. Wagendo has since gone to the Africa CDC, and I think that should be a good career progression for him, and we are proud for the work that he has done in that blood space, because as far back as I can remember, he was the man who was manning the voluntary blood donations that I have participated in. Mr. Speaker, I am honored to be supporting and contributing to this Kenya Blood Transfusion Services Bill. I pray that members will see the urgency and will pass this bill. Thank you very much, Mr. Speaker.
Honorable Chada for Mbodo.
Thank you, Mr. Speaker. Mr. Speaker, I think from outset, we need to correct a few things. One, you allowed Sankok to inform Millie, and Millie also swallowed the information directly from Sankok that the blood is given free, so we should also give it out free. I think once you get, transfusion is not like Sadoof irrigation, where you pick water in a bucket on this other side and pour it on the other side. It's very different. You pick a blood, let's say from Kasugunga or Kaswanga secondary school from a student, that blood moves. There is a cost in the movement. There is a cost in terms of screening. There's a cost even in terms of, again, movement back to where the patients are and stuff like that. It costs money. So the idea that we pick it free and needs to give it free, I think is an information that...
What is terribly out of order, Honorable Akop?
Thank you, Mr. Speaker. If Honorable Chanda could kindly sit, because that's the rule of the House. But Mr. Speaker, it's my good friend and neighbor, Honorable Chanda, in order to mislead this House by suggesting or implying that the people who donate blood do not incur costs. Every aspect has a hidden cost, the same way the government incurs costs in cleaning that blood or whatever in order to give. When I leave my house to go to the hospital, the government does not give me money. That's why Honorable Denita said in the US, you are paid to donate. So if I have actually bothered, Mr. Speaker, to volunteer and give my blood for free, why should then somebody else I'm giving be forced to pay? You see, in order to mislead this House.
Well,
I think, Mr. Speaker,
yes.
I think Mill has accepted that there are costs. I think that's the bottom line. That's the principle that I was trying to bring around, that there are costs, so it is not free. Now, Mr. Speaker, the other thing that I wanted to bring is the whole issue of data. If the chair of the committee may, at the point of responding to this, will give us the proper data that is really in front of the committee. We have had here different figures in terms of the blood units we require per year as a country. That has been varying. It has been varying from Duale, 64, it went to Swamad, 64, it has gone to Kiarie, 93, and I think what the committee has is 164,000 as at last year. So, Chair, maybe is not listening, but Chair, when finally responding, needs to bring this data in a proper, correct way. The thing that I wanted to bring, Mr. Speaker, is that the whole issue of blood transfusion, we are dealing with issues of standards. At the moment, can I continue or listen to that? Mr. Speaker, at the moment what we are talking about is...
Well, you seem to be oscillating from a point of order to point of information. To who? To who? Honorable Chanda.
Yes, I think my time may be running out because of this, but I'd requested the chair of the committee at the time of responding to come up with the proper figures where we are. Because as at now, you have given us a figure of 93. Somebody else gave us a figure of 64,000. Another person also gave us a different figure. So these figures, for us to have a clear information, can the chair give us proper data when he's responding? Not necessarily now. That's what I was asking for, Mr. Chair, Mr. Speaker. So I continue. So, Mr. Speaker, what I was saying is that the issue of blood transfusion, at the moment what's happening, and this is exactly what the bill is trying to look at. At the moment what is happening, everybody's doing everything else around blood as they want. Yeah? Then blood, in real sense, the way we were at the point, that day that we were talking about the food reserve, the national food reserves, is the point we needed to have started also talking about the blood reserves. It is late in time. We need to have done that particular time. Many countries have done that. They went from level 1, like looking at the issue of food strategic reserves, then they went to blood strategic reserves, then they went to issues of oils reserves and stuff like that. So to us, I think there's something that we've missed as a country over this period of time, Mr. Speaker. And as at 2019, the World Blood Donation Day, it was very clear, it was indicated by World Health Organization, that what we need to have is that blood cannot be handled like that. There must be some standards. And WHO basically gives us international standards in terms of what happens. Many countries has reported, developing countries, 75% of the 77 that are reported were from developing countries. Kenya was not in it. So that's where we are. Kenya was not in it. So what am I trying to say? I'm saying, Mr. Speaker, that we are late in doing this. We are very, very, very late in coming up with a manner and a framework of how we are supposed to be handling issues of blood transfusion, Mr. Speaker. And so if you look at that against now funding, because things have been so haphazard, everybody has been doing all manner of things the way they want, there's no way how we can place money for this. So we are now in a situation where we, after this legislation, we'll be having an authority, a proper authority in place that has a budget that can be funded. If you look at what has been happening, Mr. Speaker, the real funding in terms of blood transfusion has been external resources. Even this year alone, this year in our budget, what we have budgeted for purposes of our current expenditure for blood transfusion is only 244 million Kenya shillings. Meaning the rest is coming from outside, external resources. Now, if you look at this, external resources, the numbers, the figures are dropping. Yeah, the main source has dropped by $95 million, for example. So meaning that if we don't take it as a nation in terms of our own resources, putting into strategic blood banking, then we have a problem. And that's exactly what now we are rolling out. Whether they are vaccines for livestock, for human beings and whatever, the standard must be set by the national government in terms of how it is supposed to be. It's after that any other practitioner can now pick this for purposes of moving forward, Mr. Speaker. So I thank you and I support the bill.
Honorable, no, he's done. His space is gone, unfortunately. Honorable,
kupongeza wizara kwa kuchukua jukumu la kufanya majukumu yake. Baada ya wale wanaosaidia kujitoa, wao wakachukua jukumu hilo, wakaweza kusimama na kuanza kurekebisha na kuweza kufanya wenyewe. Ilikuwa kwa muda mrefu tumekuwa tukitegemea wafadhili. Sasa ghafla wafadhili wakajitoa na wao, lakini wakaweza kujidhatiti kuweza kusimamia hali ile ngumu iliyokuwa. Bwana Spika, damu ni muhimu sana. Naomba wenzangu tuipitishe kwa umoja wetu mswada huu. Hivi vituo vya damu kama wenzangu walivyotangulia vilikuwa vinafaa, walisema kwamba zinafaa ziwe kila eneo bunge, lakini kwa sasa ziko tu kwa mikoa. Na tukisema ziwe kwa county, hatusemi tuzipatie county. Ziwe hiyo ni ya national, lakini ziwe kila county, kwa sababu kuna county zingine ziko mbali na hizo huduma inakuwa ngumu kuzipata. Na damu ni muhimu kwa kila Mkenya, angalau iwe kila eneo bunge. So bodi ikiwa ihakikishe hayo mambo mengine yafanyike. Tuone maendeleo, sio kila miaka ni pale pale tulipo tu. Bwana Spika, zile watu wengi wa Kenya, Wakenya wengi wako na ile unyanyapaa wa kuogopa kwenda na hofu kwenda kutoa damu, kuogopa katika hali zao zitajulikana na wengine. Wengi wanataka kutoa, lakini waogopa hivyo. Ikiwa itawekwa siri, bill hii naona imezungumzia mambo hayo. Ikiwa itawekwa siri na watu waambiwe, wengi naona watatoa damu, ili sisi wa Kenya wengi ni wakarimu na tuko tayari kusaidia wenzetu. Lakini tu ni hiyo, wahakikishiwe kwamba siri, mfano mtu amepimwa ameonekana na maradhi fulani, iwe ni siri yake na asione baadaye imetoka kwingine. Ikitoka kwa mmoja inaharibia hata wengine kuwa na ile hofu ya kwenda kutoa damu. Bwana Spika, kama narejelea tena kwamba damu ni muhimu na tunafaa kuwa na damu nyingi. Wengine wametoa hizo hisabu ambazo hazina hakika, lakini mimi niko kwenye kamati na hii bill ni mzuri, walikuja wakatueleza na tumesoma. Kwa hivyo kuna umuhimu sisi kuipitisha, manake ilikuwa ifaa ipitishwe mapema hata kabla sasa, kwa sababu hii ni bill muhimu. Mimi tu nimeshukuru sana. Tulikuwa tunaona kwamba hii kazi ilikuwa imeachiwa Red Cross, lakini sasa nimeona wizara imeshika wenyewe kufanya mambo muhimu, huduma muhimu kama hizi. Na hizi huduma, hizi wizara zisitegemee sana donors, wafadhili. Kama kuna huduma yoyote ya afya, wizara ya afya inafaa ichukue ile majukumu, hili liwe ni funzo. Manake tumepata funzo wakati walivyojitoa wale wafadhili, wao walijitoa kwa ghafla. Sasa tusitegemee sana katika huduma muhimu kutegemea wafadhili. Mimi sina mengi, Bwana Spika, asante.
Honorable Mwambire Gubao, member for Ganze.
Thank you very much, Mr. Speaker. Mr. Speaker, I take this opportunity to support the bill. I have heard my colleagues talking about watering down the proposal to have blood banks in each counties. But Mr. Speaker, if you look at there's a number of setups in this country which have trickled down to the counties. For instance, if you look at the judiciary, they are struggling, and we have been giving them budgets so that they can establish high courts in every county. We also have the Kenya Medical Training Colleges, which have been also trying to establish campuses in wherever we have level 4 hospitals. Mr. Speaker, I think if we can consider having a blood bank wherever we have a level 4 hospital, it will assist us to move away from the ambulance chasing services, because currently, for instance, if someone needs blood in Lamu County, in the coast region, then it means that a vehicle needs to run from Lamu to Mombasa, Coast General, then from Coast General to Lamu. So the distance is very, very long, and even security is also a big challenge. So I think it will be proper if we consider, because we have county commissioners in each county, it means that national government functions are considering counties. So I think it is high time we also consider having blood banks in each county so that at least we can be having an opportunity to donate blood, and also county commissioner lost life because of because of waiting. Now consider if somebody in Taita Taveta, somebody in Kwale, somebody in Tana River or Lamu requires blood and has to go to Mombasa. So those are the scenarios which I think as members we need when we'll be coming up with the proposals to amend this bill, we need to consider having blood banks in each counties or wherever we have level 4 hospitals, so that at least we can have this service as close as possible to the consumers. With those few remarks, Mr. Speaker, I support.
Honorable Aseka, member for Kwiseo.
Thank you, Speaker. I also join my colleagues in supporting this Kenya National Blood Transfusion Service Bill 2020. So, Speaker, it is a bill that seeks to regulate matters blood donation and also blood transfusion. The bill also, Mr. Speaker, creates an authority within the ministry or within the Republic of Kenya that will really manage these matters of blood and blood transfusion and donation. The board, the bill says that it will have a board of management and it will have a budget of which, Mr. Speaker, it will create some autonomy in its financial management. Mr. Speaker, Kenyans donate blood for free. And I want to agree with my colleagues that when blood is donated, blood is transported, blood is kept, and blood is administered to patients. But, Mr. Speaker, to me, we need to allow and amend part of the responsibility of this board to ensure that those extra logistical costs that are incurred from the donation to storage, to hospital, and to transfusion are catered for. The Speaker, look in this country, Ministry of Education, Ministry of Health, and the government of Kenya supplies condoms free to even remotest areas in this country. It will not be asking too much to ask this board to take care of those costs of blood bags, blood transfusion sets, so that Kenyans who are hospitalized and are in need of these precious commodities are given this commodity for free. Mr. Speaker, we complain about having enough units of blood because the people who mobilizes for these transfusions are maybe placed in cities. You'll find a campaign in Kakamega, somebody from Kwisero cannot travel to Kakamega, donate blood. But if we decentralize, create more regional offices, up from 6 even to 47, and create satellite offices in our sub-counties so that we can mobilize as many Kenyans as possible to donate blood, Mr. Speaker. Speaker, you'll agree with me that sometimes we donate blood within cities and half of that blood we are told it's bad, it's contaminated, it's infected. But if you want pure blood, quality blood, I think when we use our local, our villages, we'll have this blood to our blood banks. Mr. Speaker, lastly, we need to provide more resources to this unit, to create more of these centers, to procure more of the equipments, and to ensure that it employs more staff. You saw even in the report that the department is really understaffed. So without enough resources to this unit, we may not attain the objective. Otherwise, Mr. Speaker, I support. Thank you.
Honorable Aseka, is that science-based, that argument that the blood in the cities is largely unacceptable because of infections. So we should focus on the villages.
Mr. Speaker.
But don't contribute further to that. But I found that quite quite an argument there, and you are entitled to it. Actually, it could be factual. I don't know, but I found it quite interesting. Honorable Bashane.
Thank you, Speaker, for giving me this opportunity. And on the onset, I will say I will support this bill, Kenya National Blood Transfusion Service Bill 2020. Mr. Speaker, the nature of Africans is that they have that ability, that willingness to assist. And when it comes to, for example, blood and water, they are more than willing to assist generally. But what we are lacking, we will have even reached, I believe, the 500,000 units which we require annually, we will have reached if only there will have been better coordination. The precursor to this Kenya Service Blood Transfusion Service, if they will have had, they were better in mobilization, education, and sensitization, I believe we will have got the target we required. But unfortunately, that was not possible. The other aspects, Mr. Speaker, which hindered is lack of finance, which this bill is trying to cure. If we get the finances required, I believe we'll also be able to reach that target which is required. The other aspect which limits, Mr. Speaker, is the stigma associated with blood transfusion. Our communities, when we normally go to hospitals to donate blood, we go in groups of 10 or 20. Unfortunately, when someone is told your blood is not suitable, that information, the right information, why your blood is not of good quality is not told to the people. And this bill will now solve that problem, whereby the rights of the donor to information, consent, and confidentiality will be told. Mr. Speaker, one other aspect which hinders for us to reach the target is the trading of blood. We have realized and we know every time in our neighboring countries, blood leaving Kenya has been found in several other areas, as we have seen in the media. And that kind of aspect, that corruption, by having this body, I hope this problem will be over. I don't want to take a lot of time, and I say I support this bill. Thank you.
Honorable Guna, member for Mwingi West.
Mwingi West, yes.
Yes.
Thank you,
You
Mr.
have the floor.
Speaker, for the opportunity. Mr. Speaker, I want to congratulate the committee for the good job they have done in coming up with this bill. And at the same time, congratulate the mover, my friend Honorable Kutun, for well-moved bill. Mr. Speaker, from the history, I'm a beneficiary of blood donated by several people when I was very young. And I know the hectic thing a person goes if you are looking for a blood transfusion. It perplexes me sometimes, Mr. Speaker, when I see a lot of communication going on through WhatsApp and other places, actually asking for a blood donation for a particular person. And Mr. Speaker, you will bear me witness that majority of even Kenyans don't know their blood group when we are speaking about this bill. So this is a very timely bill which actually needs support and also proper implementation. We may legislate, but if there is no implementation, Mr. Speaker, this bill will not help Kenyans. From the onset, Mr. Speaker, let me say that I recognize actually the effort of establishing the Kenya National Blood Transfusion Services. And the bill has really outlined the functions the service is going to do. And I would like to say one of the key important aspects is number C, which says that the standards in respect of blood donation, collecting, testing, processing, storing, importing, and all this manner, Mr. Speaker. Mr. Speaker, this bill has really given this body a very serious thing which actually needs to be implemented, Mr. Speaker. And I think the rules are very clear. The other thing is the needs, the national needs, the county needs, the country's needs. Most of our doctors, Mr. Speaker, we fail because we don't know the needs actually based on the national and international guideline, Mr. Speaker. One of the key issues, and which is very critical, Mr. Speaker, this service...
Order, Honorable Gunnar. It is 6:30, and the House must rise. You have, when this is scheduled next,
Yes.
you have your 6 minutes.
Thank you.
So that doesn't mean that you have lost your 6 minutes. Honorable members, at the time being 6:30 p.m., this House started adjourned until today, this evening, Wednesday, 23rd June 2021, at 7 p.m.
Today, Wednesday, 23rd, 7 p.m. Yuko hiyo. Tuko ndani ya city.
Jumia presents Kila Kitu, Kila Siku. It's been 6 months since Mom got her new phone and she still doesn't know where the camera is. It's Jumia's anniversary sale and we're celebrating with amazing deals. So find an excuse to spoil someone. Jumia. Kila Kitu, Kila Siku.
Ya mambo yote atakiwa ufikishwe mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe, na ili kustawisha amani, ufanisi na heri ya nchi yetu, na wale ambao haja zao umezikabidhi mikononi mwetu. Amen. Proceedings.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers.
Leader of the majority.
Honorable Speaker, I beg to lay the following papers on the table of the House today, Wednesday, February 19th, 2020, in the afternoon sitting. Quarterly Economic and Budgetary Review for the first half financial year 2019-2020 from the National Treasury and Planning. 2, the third quarterly report covering the period from 1st of July 2019 to 30th of September 2019 from the Ethics and Anti-Corruption Commission. 3, the reports of the Auditor General on the financial statements in respect of the following institutions for the year that ended 30th June 2018 and the certificate therein. Brand Kenya Board, the National Environment Management Authority. Number 4, the report of the Auditor General on the financial statements in respect of the Imarisha Naivasha Trust for the year that ended 30th June 2017 and the certificate therein. And lastly, the report of the Auditor General on the financial statement in respect of the Game constituency for the year that ended 30th June 2018 and the certificate therein. Thank you, Mr. Speaker.
Very well. Next order.
Order number 6.